Abdominal wall defects. Gastroschisis. Gastro is derived from the Greek word gaster, which means belly, and schisis means to tear or to split from. The abdominal wall is defective and the organs are protruding outside the abdomen. The incidence is 4 in 10,000. Male to female ratio is 1 to 1. The associated congenital anomalies more than 10 to 15% in the form of bowel atresia, congenital heart disease, ventricular septal defect, cleft palate. 40% are premature and small for the gestational age. The risk factors include old maternal age, prematurity, low gravity, low birth weight, secondary to intrauterine growth restriction. Etiology and mechanism. The defect is towards the right side of the umbilicus. No covering membrane, failure of migration and fusion of the lateral folds of the embryonic disc at the third to fourth week of gestation. Disruption of the right omphallomesenteric artery by the 10th week, causing ischemia of the abdominal wall and weakness followed by herniation. Rupture of the omphalocele. Clinically, defect to the right of an intact umbilical cord allowing extrusion of abdominal contents. Normal site of origin of the umbilical cord. The defect is less than 5 centimeters. No covering sac. Evisceration of the intestinal loops only. Bowels are often thickened, matted, and edematous. Associated anomalies in 10 to 15% of patients. 40% are premature or small for the gestational age. A photograph for the defect with the umbilical cord present intact. Investigations. Alpha-feto-protein, AFP, is synthesized by the fetal liver, excreted by the fetal kidney, and crosses the placenta by the 12th week. Elevated maternal alpha-fetoprotein occurs in cases of neural tube defects, abdominal wall defects, duodenal or esophageal atresia. False positive results occur in 40% of cases. Positive in 10% of cases of exomphalos. Positive in 90% of cases of gastroschisis. Fetal ultrasound after 14 weeks gestation is confirmatory. Treatment. Primary closure for cases with easy reduction of the eviscerated bowel. Staged procedure. SILO. The SILO is a sterile intestinal bag fashioning excision of the sac, full thickness suture of the SILO to the rectus fascia. These are multiple SILOs. The SILO after application. Good luck and best wishes.